Hello, my name is Jorge and I'm going to present about breast cancer. Have you ever heard about breast cancer? If you ever or not, this may interest you because cancer is the second leading cause of death from cancer in the world. So there is a probability that you may have this disease and do not ever notice it. This research will inform you on how to detect it early and what to do to treat yourself as fast as possible. Because the more time passes, the risk of death increases and the severity of the disease increases. These are the research questions we ask ourselves at the beginning of this research. Our objectives: teach how to detect breast cancer early, inform about the risk of late care from this disease, teach how to properly self-examine for lumps or abnormalities in the breast. The materials: we use phone and WhatsApp for the interview and the survey, laptop and Wi-Fi for the investigation and making the survey by Google Forms, a place to work, also in our case, a desk, and for the survey, people we interview via WhatsApp. Hypothesis: using the appropriate methods and self-examination, the population can be encouraged to constantly check the breast. In addition to having an annual checkup with the oncologist, we can increase that early detection of breast cancer and thus decrease deaths from it. Here are our survey results. From what we see, breast cancer is something quite common, and most have answered that they know or have ever known someone with breast cancer. We find a little more than a half do not know how to examine themselves, and a little more than a half have not examined themselves but show interest in learning how to do it. The interview results also are data collection technique. The way in which I obtained the information was through an interview with Dr. Manuel Alcosta Alfaro, an expert on the subject and considered as the best doctor in the field in Culiacan City. The doctor answered the questions about breast cancer and answered us about the risk factors from breast cancer, which some of those mentioned are being a woman, the age, also the older is the higher the risk is, and increases the risk from age 35 onward, and the family history of cancer, obesity, smoking, alcohol, and where he's based on his experience, he answered that uh, 80% of doctors' patients only present as a risk factor being a woman and being over 35 years old. He also told us about the different types of cancer that exist and how to detect it, and the ease of detecting it. In addition, in one of the most common causes of death from breast cancer, which is late detection, and the lack of breast exams. Experiment. This is the evidence. This is our poster and the experiment. I use as an experiment the information from the Center for Disease Control and Prevention, and I base my experiment on one that was carried by Venezuelan Society of Oncology, where it is verified that exposure to the substance 1-methyl-1-nitrosourea can cause microgranular adenosis, which later progressed to a breast carcinoma. Conclusion. In conclusion, what I obtained from the surveys was a database which helped to conclude that people do not know much about how to self-examine and how to do it. However, people are interested in learning how this information obtained by the surveys help us to be able to act based on the responses and to be able to make a change. So we can conclude that by informating them about how to do it, in addition to another tips from early detection of breast cancer, which were given in the interview with Dr. Manuel. So it will help us a lot to reduce the cases of death from breast cancer. So our hypothesis is fulfilled. is some tips so how to self-examine yourself and the reference. Thanks.